So,
Mm-hmm.
starting with a fact from WHO. So, India has around 20,000 rabies death in a year, and
Yes.
90%
Mm.
से ऊपर जो इसके cause हैं, that's because of dogs bite. So,
Yeah.
we want to understand, sir, कि ये rabies मतलब किस तरीके की disease है, and क्या ये सारे stray dogs को होती है? And deaths, like seriously, क्या डॉग के काटने से एकदम डेथ हो जाती है? सो ये थोड़े से फैक्ट्स आप हमें प्लीज बताइए.
Yeah, sure, definitely, Shweta. Rabies is a viral disease. So it's a zoonotic disease. Zoonotic disease means it's transmissible from animals to man, and it can be vice versa also. So it's a viral disease, but nobody, even if a rabid animal bites you, you're not going to die if you take the necessary precautions in time. So just like depends upon the site where you are bitten. The more away from the brain, the more it takes time for the clinical symptoms to show. So just take for example that the animal is rabid 100% and he bites you. If it bites you in the face, it's an emergency, so you have to go and get yourself treated. But the first aid, what whenever you are bitten by a dog, you have to wash your. The virus is so fragile that even with normal soap, it will get destroyed. It's very fragile virus. So whenever you are bitten by a dog, always wash that part at least for 10 to 15 minutes in running water. That itself will wash away the virus. After washing that wound, then you can apply povidone iodine, Dettol, or whatever antiseptic is available with you. Even the hand wash now, everybody is very with COVID disease, everybody is sanitizing themselves. Even that sanitizer also you can use. So that will neutralize the virus. Then you have to go for post-exposure vaccination. And there are different degrees. The closer to your brain, because the virus travels from the nerves to the brain. So before it reaches the brain, if you get yourself vaccinated, you are safe. And the post-exposure vaccination schedule is day 0, then after 3 days, then after seventh day, then 14th, then 28th day. Since it's epidemic in India, so 90 days is 6 short. And on the first day, even human, there is anti-rabies immunoglobulin also is injected around the wound site. And even in Delhi, I know in Safdarjung it's done free of cost. The serum is very costly. It costs around 10,000 rupees, but government is doing it free of cost. At least I know in Delhi, in Safdarjung, there's a special unit, especially for dog bite, cat bite, and they do all the vaccination also free. So if you get vaccinated in time, there is nothing to fear. If you don't get yourself vaccinated, then if the disease occurs, then you won't survive. That's for sure. So if you get yourself vaccinated, there's nothing to worry. And all dogs are not rabid. That's for
अच्छा,
sure.
all dogs are not okay. So
Yeah, and
it's an infection. Some dogs can carry the
it's
infection
a
and some.
viral disease. Once they
Hmm.
suffer from the infection, once it reaches the brain,
Hmm.
then it comes from the brain to the other different parts. So then it comes in your salivary glands of the dog, and then their bite becomes infective. So whenever a dog bites you, we say that observe the dog for 10 days. If the dog is well within the 10 days, then you are safe. Still, you have to get yourself vaccinated, but you are safe. You observe the dog. If you can observe the dog, sometimes even you are not able to trace which dog has bitten you. But if you are able to trace, just observe him for 10 days. If he's fine, he's eating, he's healthy, then you don't have to worry about anything. Still get yourself vaccinated, but nothing to worry about that. Because if he's rabid, he'll die within 10 days. When his
Hmm.
saliva becomes infective, when
Hmm.
the saliva is having the virus, then only he'll be able to transmit rabies. So if he survives 10 days, then nothing to worry about. That's
तो
it.
इसमें सर हमें पता कैसे चलता
Hmm.
है कि a particular dog is infected from rabies? कोई symptoms होते हैं क्या?
There are two types of rabies in dogs. One is the furious form and one is the paralytic form. So
Alright.
furious means when it affects the brain, there is inflammation in the brain. So he'll go crazy. He'll bite at imaginary objects. He'll eat all rubbish things. He'll eat mud. He'll eat stones. He'll bark aimlessly. He'll keep wandering. A rabid dog can even migrate up to 40 kilometers, and he'll keep barking at and he'll biting everybody, unprovoked, unprovoked
अच्छा.
biting.
If such cases are happening in the society, then one must should contact the nearby organization जो भी है कि
You
chances हैं
can
कि इसे rabies है
you can contact an organization or a veterinary hospital
veterinary hospital.
and observe the dog for 10 days. If he's rabid, he's going to die. That's for sure. They don't,
अच्छा.
once they start manifesting the clinical symptoms, they don't live more than 10 days. When they are able to transmit the infection. So when like you feed dogs, so you can make out a dog is acting differently.
Yeah,
This was the
true.
furious form. There is another form which is called the dumb form. That is the paralytic form. In that there is paralysis of the jaw. No, and he's not able to move. So that's the paralytic form.
Right.
He won't be able to eat. He won't be able to swallow. Maybe just
I
lying
am
in one
sure
place.
that must be clearly
Yeah.
visible. Yeah, because
And
I have
typical
seen
other please carry on.
you were saying something. Yeah. So you were saying something. Yeah.
I was saying that the typical symptom of foaming at the mouth. There will be droopy. There will be a lot of salivation. There will be foaming at the mouth. So these are also symptoms which you must observe in a dog. And he will always be in a attacking mode, or biting unprovoked, or eating all rubbish things. So these are the symptoms which you can make out that he must be rabid. And if it's biting some dog, the dog also may not get it at that time. It takes time to reach to the brain, and then they will show symptoms. So you can get the
Very
dogs in the
clear
vicinity
symptoms.
also. Yeah. So there are very clear symptoms. You can make out a dog is rabid, but you can't confirm the rabies until his brain is sent to the lab, and then it's confirmed 100% the dog is rabid. So these are symptoms which you can watch for.
All right. Okay.
Yeah.
So, sir, अगर हम इन dogs को vaccinate कराते हैं for rabies, then how frequently we have to do this? मतलब क्योंकि हमारी भी जब vaccination होती है, even in human, so there is a period कि इतने time बाद हमें दोबारा करा लेनी चाहिए, effect कम हो जाता है. तो rabies में कितने time में effect कम हो?
Rabies vaccination, if the dog is a puppy, it's not given before the age of 3 months. Once it's given at 3 months, then a booster after 1 month, then it's once a year you have to do.
Once a year.
Once a year. In India, it's endemic, so we do it once a year. The shots which we're using are fixed vaccines, fixed live attenuated vaccines. So you can even, in the USA, the immunity is for they repeat it once every 2 to 3 years. In India, we do it every year. Booster vaccination is required every year till the dog lives. And in that case, if it's bitten by a rabid dog, it doesn't mean they don't have to get vaccinated. Again, it depends upon the severity of bite, where he is bitten. And then again, if it's within two months of the vaccination, then you can give him 2 shots. 2 shots will suffice. If it takes more than 6 months, he's bitten by a dog, stray dog, then you will have to go for, again, post-exposure 5 vaccines, which I have explained, 0, 3, 7, 14, and 28 days.
All right.
So this is a protocol you have to follow.
नहीं कुछ लोग कहते हैं कि हल्दी लगा लेते हैं और नमक लगा लेते हैं और मिर्च लगा लेते हैं तो
मिर्च it's not good because it's a virus. Washing itself is the best thing. 10 to 15 minutes in cold running water that will.
But then also one must see a doctor.
मिर्ची जलाएगी तो उल्टा वायरस अंदर पेनिट्रेट कर जाएगा. Once it reaches the nerves, then it will centripetally transfer through the nerves. It will go to the spinal cord and to the brain. So never apply chili. Chili is not a good thing to apply. Usually I've heard in villages people do that. It's not a good thing.
Yes, I have also.
Yeah. So wash with hands, normal soap water, live boy, that itself neutralize the virus.
And then
you can apply betadine. It's easily available, betadine, povidone, iodine, Dettol, any antiseptic, chlorhexidine, any antiseptic will do.
All right.
Yeah.
So basically, if we summarize, rabies एक preventable disease है और ये हर डॉग को नहीं होती. अगर कोई ऐसा इंसिडेंट होता है कि अगर आपको कोई डॉग काट लेता है तो just go wash that surface and see a doctor.
Yeah, and get yourself vaccinated. Post-exposure vaccination is very important. Right. The protocol I have already described to you what to follow. That's very important. Even if a dog scratches you, sometimes people say कि मेरे बच्चे को काट लिया है, उसको वैक्सीन लगा दो, मुझे थोड़ा सा स्क्रैच लगा. Dogs keep licking themselves. So even a scratch also can cause you rabies if the dog is rabid. So don't take it lightly and get yourself vaccinated. Go to the nearest government hospital or wherever you can go and get yourself vaccinated.
Yes.